Welcome back to the American College of Surgeons Bulletin Brief from the Front Lines, Surgeons' Voices. With me today is Dr. Chantal Reyna. Dr. Reyna is the Medical Director of the Breast Program and Chief of Breast Surgery in the Crozer Health System in Delaware County, Pennsylvania. Welcome, Dr. Reyna.
Thank you for having me. It's a really pleasure to be here.
Well, it's a pleasure to have you here because you can share a lot of important information with our listeners and viewers about a couple of things. And firstly, I'd like you to talk a little bit about some of the work you do with the Association of Women Surgeons and the Latino Surgical Society, because there's a very important intersectionality there. And I'd like you to share some thoughts about it, if you would.
Absolutely. I appreciate the opportunity. So I actually am very active in both the Association of Women Surgeons as well as the Latina Surgical Society. I have served as the liaison between the two for the last year and have recently become the chair of the Publications Committee. And what I've really appreciated about that is that the Publication Committee has split into an actual advocacy and academic portion. So we actually do a lot of advocacy within that group. And in terms of intersectionality, we basically had a big focus and during our last meeting about having different representation, people who are Hispanic and female or Native American or female, just highlighting that you are actually adjusting not to just one underrepresentation in medicine, but actually two. And there are different aspects and different challenges that come with each of them. It's right when you're starting to get comfortable with one, then you have to adjust for another. And does that really affect how we interact with our patients? Does it affect how we interact with our colleagues? Does it affect how we see ourselves and how do we represent ourselves to both of these categories?
So what are some of the answers that you've come up with thus far? Or if you don't yet have the answers, what are some of the specific initiatives that are underway to find those answers?
So a lot of it is, once again, just increasing awareness. For a long time, we've been talking about underrepresented in medicine. And it's not really till recently, at least I've seen in terms of education and publications, where we've now also started looking at those two intersectionalities in terms of Black students and Hispanic students, and what are their matriculation rates? Is it different than if you're just looking at the individuals? And how do we start increasing that impact? How do we increase that visibility? And so a lot of it is making initiatives. And one of the things that I've learned about DEI is that it can be a very daunting thing as an organization, as an institution, even as an individual, is how do I even get started? And it can be almost paralyzing. And what it comes down to is just really picking one thing, and that can branch out to multiple others. So for example, from an institutional or organizational standpoint, increasing your recruitment. How do you increase that recruitment? Well, look at your search committees. Look at how you're looking for patients. Who are the people on your search committees? And it doesn't just have to be URMs. Diversity means diversity in mindset, diversity of backgrounds, diversity of education, experiences. So taking all of those things and even just changing your search committee, you can start changing your recruitment. And once you start changing recruitment, that may lead to a change in education. That can lead to maybe bringing on someone who's an activist for students. And it's just picking that one thing that can ripple and kind of grow from there.
Thanks very much for those insights. You mentioned backgrounds, and we're all products of our own backgrounds. And if you wouldn't mind, if you could please share with us your background, how you got from wherever you started to where you are now.
Yeah, I think I would have to start that actually with my family. So my dad immigrated from Mexico when he was 20, didn't speak English. He came here, he met my mother. And at that point in time, our family started to grow. And it was a very interesting time because I had this experience of, I want to go into medical school, but I didn't have anyone who had gone into medical school. I don't have any doctors in my families. I don't know what that path is, what that career is. I didn't have that kind of blueprint of, oh, you need to do this, this, this. I had to struggle to figure out how to do that, which was quite a challenge. I had to really work. So I ended up going to college on a soccer scholarship. So I am a very avid soccer person. I love it. I go to the World Cup every 4 years, which also helps with my travels. But that's how I ended up going to college. I got scholarships and I played. And then when I realized I really need to buckle down for my academics, I ended up giving up sports and became a resident advisor and worked the rest of the time. It paid for my room and board. It gave me life experience on how to interact with people, how to be team members, how to build a group, how to build a community. So it was a very different experience, but a lot of it came from, I did these things because I had to in order to make sure that I could afford things, but at the same time, gave me the life experiences. I will say though that despite having a 4.0 GPA and doing decently on tests and whatnot, I was still waitlisted for medical school. And so that was a devastating hit after you've worked so hard and just knowing, okay, this is what I want to do and having that perseverance. And here I am now, you know, not even a decade later, and I'm now a medical director of a breast program. I just want to be that example for students out there in high school and undergraduate that you might not know the path, you might not have someone there, but it can be done.
Well, you're clearly very driven. You've got great vision. You've set out a path for yourself. And as you were recounting the abridged version of your life's journey, I thought, you know, with a 4.0 GPA and being waitlisted, you're also resilient on top of everything else. So you've got a lot of great attributes. How do you impart those? You mentioned high school students, and you know, if I were a high school student and I didn't have a role model, and I'd look to you and say, "Wow!" And she also plays soccer and she likes to travel. So, how do you relate to people to get them engaged, to embrace them, and help bring them along and realize their aspirations, or maybe not even that they're their aspirations, but once they hear yours become theirs, and how do you mentor them along? You know, in other words, ignite that flame in some and kindle it in others.
So part of that, I think it comes down to two things: availability and listening. Can't tell that I actually do listen. I talk a lot right now, but those two things are really the biggest challenges, and really the best way to engage people. So at our current program, we started reaching out into our high school and undergraduates to reach out to them in part of STEM programs. The Association of Women Surgeons has a really good student mentoring project that we started going on. They just also started an academic reviewer project where their senior faculty mentoring junior faculty to help them. And so it's really taking the time to be a part of that, being visible, being accessible, being available, and then talking to them about what they want. What do you need? How can we help you? It really is a servant leadership kind of role.
Yeah, it's a very impressive program that the Association of Women Surgeons has, and I'm very pleased that Kevin Burns and I, through Surgery Journal, are working to help support that program. And I've got it in my calendar for 2 Monday nights, I think.
It's the 13th.
So, yeah, that's a great program, and but you're not nearly as talkative as are your birds. Your birds are certainly trying to get into the act.
They are attention seekers. I'm pretty sure that's why we get along pretty well together. So I have really taken on to birds, mainly because since I travel a lot, having an animal that needs a little more attention, dogs, things like that, was not as possible, whereas birds seem to take care of themselves for the most part. But it's nice to have some kind of lively conversation in the background, chirping and whatnot.
What kind of birds are they?
So these ones are parakeets that you can hear. I actually have a Quaker parrot and some finches as well. The reason being is that my husband and I, he's also a surgeon as well, we commute back and forth. So we also have a relationship that is kind of a distance relationship. So some live with him and some live here.
Very interesting. Now, one other question, just when we speak about some of the intersectionality, you also have that with patients. And I'm wondering if you can tell us some of the challenges. We've heard a little bit from the American Cancer Society, from Bill Kantz, as well as from Heidi Nelson from the cancer programs, about some of the delays in diagnosis from or during COVID-19. And breast is certainly one of them, where people were not going to get their screening mammograms and breast examinations. How are you dealing with that issue now in the women population and the Latina women population to get people caught up and to get them back out where they need to be?
So I will tell you that it's really interesting, and I don't know if you know much background about this, but Latinos are really the fastest growing population in the US. And when it comes down to it, the risk of breast cancer in the Hispanic population is actually a little bit lower than the average. However, even though mortality rates are decreasing in every population, it's slower to decrease within the Hispanic and Latino population. So there's something going on that is somehow we're not addressing it. And I think a lot of it has to do with what you mentioned. It's about screening. It's about getting people back out, especially with COVID. Even before COVID happened, the Hispanic population was very known to have later stages of diagnosis, to have more aggressive breast cancer disease, triple negative, HER2 positive. And so a lot of those things already were factors. And then you had a pandemic, which then decreased access to screening, and people didn't want to come to the hospital. And so one of the things that you really need to focus on when you have this situation is, how do you tell your patients that we are taking every precaution? You need to time out your mammogram so that there is time between those patients. You need to limit the space, or how many are going to be in a room at one time, masks, cleaning, all of those things. And you have to convey that to your population and let them know that we care and we are going to make you as safe as possible, but please come in so that you don't come in with such late disease. And it's something that we were already facing in that population before this even started.
Well, I see that you're a fellow of the Society of Surgical Oncology, as well as a fellow of the college, and obviously active in the other two societies you mentioned. Are there formal initiatives from some of those groups to get people back into your office?
So I can only speak to our own institution at what is going on currently. In terms of national organization, the Commission on Cancer, as well as the NAPBC, which fall within the American College of Surgeons, have made initiatives as part of our quality. It's a call to return to screening. And so programs could actively do interventions and track how many patients, how many screenings have gone up. And it counts towards your accreditation, it counts towards some research, but really the main goal is being active to get patients back in. That is the main goal. It's all about patient care. We can get our accreditations, great, that's wonderful, but it's about getting those patients back in and doing little things, whether it's physician education, patient education, email reminders to everybody. Those are the ways that we get them back in.
And lastly, speaking of ways to do things, not every high school student or college student might be fortunate enough to have met you or be directly mentored by you. So let's say somebody has kind of a vague interest, but they don't know how to mature that interest or how to be mentored. What are some suggestions you have for those people?
I am a big believer in reaching out to organizations, to your fellow colleagues, even to family members and friends. So reaching out to the Association of Women Surgeons, reaching out to the Latino Surgical Society, we have a very open book, very open door policy. You reach out to someone, they're going to respond to you, cold emails. And what I love about those societies is that if I don't know something, or if someone wants someone closer to home, I can just reach out to anyone in the organization and say, do you know someone that might be willing to do this? And I can email someone I've really never met before, but because we're a part of this organization's, it's a yes, how can we help?
Very good advice. Happy to give you the last few minutes in case you want to add any additional comments. Clearly, you're very enthusiastic and passionate about what you do. And if you have any other words of encouragement for folks, please share them.
So I would say one of the biggest messages is, as we go forward with diversity, equity, inclusion, justice, all of those things, it's really about not just the awareness. You have to be active. It has to be a decision. It has to be that we are ready for that kind of change. And it can't just fall on those organizations that represent us. It has to come from allies. And so even if you're like, I don't know how to start, just reaching out and saying, how can I be an ally? And just looking at yourself and saying, am I ready for this change? Where am I at? How can I do this? And there's always going to be someone that you can reach out to that will help take you on those next steps.
Great points, and the college is also a great resource now, has been for 19 years in the DEI space, which not everybody realizes, but we also now, of course, have the governor's pillar and the Regental committee and the DEI program in executive services, and many programs and initiatives available. So thank you very much for your time today. Good luck with your soccer, your traveling, your birds, and of course, your job. Hope to meet you in person somewhere along the line when COVID settles down.
Yes, I appreciate that order also. Thank you so much for the opportunity. Really, it's been a pleasure.
Thanks.